Dr Aslam Dasoo is the co-convener of the Progressive Health Forum, and he joins us now via Zoom from Johannesburg. Dr Dasoo, thanks very much indeed for joining us. Welcome to the program. The President perhaps had a really tough speech to make today because there's constantly this balancing of the economy plus health. In the ideal world, we just shut down everything completely and manage over the Christmas period, but that's not reality. And I just wonder if the measures that he's introduced and talked about are going to be enough given what we're seeing.
Good evening, Peter. Thank you for having me. Yes, I do think that the President has a very difficult task, but he knocked the ball out of the park, in my view, during this speech, because unlike the other many speeches we've had bringing us down from one level to another of a very damaging lockdown, it appears the risk-adjusted strategy that they have been developing has been properly applied in this case. They've taken the trouble to apply these and enforce compliance with what I believe are quite reasonable restrictions. The reinforcement of the level 1 restrictions throughout the country, I think, is also to be welcomed. There's little to quibble with, except perhaps maybe the Eastern Cape and the Garden Route may have something to say about the complete shutting down of their beaches. Although it's a very difficult call to make, and I think they've taken regional views into account to manage the situation.
How do we manage travel? Because that, I guess, really at the end of the day is what's going to be how the virus is going to spread, isn't it?
Sure. I think there's been already a lot of travel certainly to the coastal provinces and other areas, and there will be a return inland at the end of this festive period. And as you put it, the virus will travel with the people. We've always expected that this would occur. However, it's very important that if people do adhere to the President's very earnest appeals, what we might find is that we might have an attenuated second wave without the expected huge blowout. But the travel is an issue. We have full taxis, buses, even planes, where the compliance with mask wearing and distancing is often ignored. And that's going to be the difficult thing. But in this instance, why this is such a significant set of measures that they've put forward is because what has been very clearly identified as the major cause of the second wave has been super spreader events. And they've put a decisive clamp on those. Look, it's still going to be difficult to manage the beaches, even though we've closed them, or they're going to be closed from the 16th onwards in the Eastern Cape. But in other areas where you close them down for just 1 or 2 days, there's going to be a crush in the intervening days. And the way that is managed is going to be crucial to determining the degree of spread. Of course, the other gatherings, parties, church events, music events, and so on, there's just no way that we can allow for that to happen. And, what I heard in him was asking the country that you have to do this once. If we get it right now, with the rollout of vaccines, we won't have to do this again. It's not much to ask. And I think people should listen.
What must be a concern is the demographic. These young people have increased in terms of, being carriers, I would say, of the virus, because they're probably going to be asymptomatic, most of them.
Yes, that's quite true. They don't demonstrate the same level of illness that older people do, and they do carry the virus. And we're seeing the super spreader events from these post-matric parties on the coast already impacting other provinces. So look, it's been a long year. It's been a tough year, and especially for young people. And now that school is closed and the holidays are here, one will be silly not to expect that there will be an exuberance at play. This is what we have to manage. Parents are going to be crucial in this, not just the government. I think communicating with people there has to be a step change in that. The communication through TV, radio, newspapers is not enough. You have to have community level communication from trusted communicators, leaders of communities, speaking in the idiom to which people there are accustomed. And I think then you'll begin to see compliance. Of course, there's going to be law enforcement. My one concern is that law enforcement often in this country has a heavy hand. And that's not the way to ensure compliance, especially at this time. But I think the measures that have been put in place are quite targeted, they're quite specific. Businesses must play ball with this. Restaurants, bars, and other areas where people congregate will have to apply the necessary measures. And I think the president was quite clear that they're going to hold them responsible if they don't. So it's these small things that I think, or that seem small, that will have a major impact on the spread. If I can just talk a little bit about the health facilities, the pressure is certainly on in some of the provinces. The Eastern Cape is at saturation point, we know. Lots of healthcare resources and personnel have been requested, promised, but they're yet to materialize. And I think this is a real problem because health workers, if they get sick, then they are taken out of the system without being replaced, leaving the burden on the rest. This is a cascading event. When health systems and health services collapse, then we are in deep, deep trouble. We're close to it in certain areas, other areas coping quite well. The big explosion, so to speak, we will see throughout the country will be in late January when people return and sickness starts to develop. So the other provinces need to use this time very productively to get ready for that expected wave. If we keep to the measures that the president has asked for, and if the government does what it is meant to do, I think we will have less of an explosion and we'll be able to cope.
All right, so what lessons can we learn from North America, from Europe? The UK had a second lockdown, Germany's going into another lockdown. Could it be that if we don't comply, that perhaps we might have to step things up even more?
We might, and I think he was quite clear about that, though we would be very reluctant to encourage a further shutdown. The knock-on health effects of shutting down the economy will make COVID look like a walk in the park if we are not careful. Look, what's happened abroad mimics what has happened here in terms of the second wave. At the end of the summer holidays in Europe, they started to see the uptick in cases. And what they also noticed was that young people, in particular, returning from the holidays, having been partying in very crowded areas, create super spreading events. So those lessons, I think, have been learned. We also have learned that only these personal protective measures that we can take can keep us relatively safe until vaccines arrive in numbers that can vaccinate the population, give us some level of herd immunity. This is going to take time. 2021 is going to be a waiting game for us. The president has promised that we might get about 6 million doses in the first half of next year. That will be used for the most critical personnel and for elderly people. It's nowhere near enough. And one presumes that they are in negotiations with pharmaceutical companies to procure more, as is every other country in the world. So it's a tough thing. And I think we should gird ourselves for a year of maintaining our non-pharmaceutical interventions as best and as stringently as we can until vaccines arrive. The idea that there could be public-private partnerships in procurement is a good sign. And, you know, there are other measures. For example, and this has been put forward by the Medical Research Council, that we have to do increased surveillance on wastewater. This is a signal marker that when you pick it up in wastewater, you have a 7 to 10 day lead time before the first cases start to appear, and you can target those areas. So these kinds of innovations and actions will have an impact. But we are in the midst of the pandemic. We will continue to be until we have sufficient vaccination.
All right, Dr. Dasoo, we'll leave it there for the time being. But I get a sense that ultimately it's down to us, the people, really, how we manage this going forward. Thanks so much for your insights today.
You're most welcome. Thanks.